This is the No Stroke Podcast with your co-hosts David Dancero and Michael Garrow, helping you to support and thrive in life after stroke. Their podcast is designed for educational and community support purposes only and should not replace medical treatment and guidance of your own health professional team.
Welcome to episode 49 of the No Stroke Podcast. My name's Dave Dancero, and I am here with my co-host, Michael O'Garrow.
Michael O'Garrow, yes, we're on the back of the Irish holiday, St. Patrick's Day. Wearing the green, of course, to represent. Excited to get over there, see my friends, and catch up, hopefully, with some of the early folks on our mission here with stroke. Dr. Ronan Collins, hopefully, going to be able to get that interview scheduled while I'm over there. But Patty's Day.
Yeah. Well, you're sounding better than when we recorded this episode with our guest, Sarah Belson, earlier. So I'm glad you rallied. I don't know what concoction or what cocktail you had last night, but
a good hot whiskey does the trick.
I've heard that does it. Well, you look better, you sound better, so let's get into it.
Yeah, I know I was struggling there for a couple of days, but well rested as I can be, and feeling better. So thank you. So I think this interview, we jump over the pond interview of women that we've been connected with probably just as long as we were saying with Ronan, going back to when I was still in Dublin. Sarah Belson. So Sarah Belson she's from the UK and has been working with the World Stroke Organization for about 8 years now. I think started in started in 2015. And her role is really looking at stroke support organizations across the globe, and trying to identify all these stroke groups, and then speak around all right, what are common challenges? Also, something we know all too well, David, right?
Yeah, for sure.
And that's, before we started recording here, it's what we were chatting with around, just how you scale an effort like this. And, it's something we've been at for a year and a half now, to over 2 years, with the podcast alone, and, more work prior to that. So Sarah brings some great insight into really the challenges that stroke support organizations are seeing across the globe. And then, we dive into great discussion around an event that just came up recently, the Safe Alliance for Stroke out in Europe, led by woman Avril Drummond, who we hope to get on here soon. And, it's kind of the first time that you've seen the patient and kind of whether a survivor caregiver voice represented and actually, at an event. And we spoke to, wouldn't it be nice if all survivors could get there? But unfortunately, it's not the reality for everyone to be able to be there. But what this group is doing from an alliance perspective, really focused just on life after stroke, I think is super important. So it was great to chat.
Yeah, it certainly was. And as you alluded to there, we've seen a lot of siloed efforts here in the States, mostly volunteer efforts by stroke survivors and caregivers. And what we talk a little bit about in this episode with Sarah is really that, it gets down to the funding formula, right? To be able to sustain these efforts and unite the efforts. And I love the work that she's doing over there, and certainly will follow. I wish we had time to talk a little bit more on the prevention side. I had some questions for her, but maybe we'll have to get her back on, because in reading some of her bio sketch, I liked the work that they were doing with, there were things like a return to work pathway and other things that I think are important. And maybe we will be able to meet up with her at the, the World Stroke Congress we mentioned at the episode in Toronto at the end of this year. So
it's coming up in October.
Yeah. So that's a great intro, Mike. I've got to get running to get off to see some patients. So let's what do you say? We kick this one off. This is again episode 49. I think we're going to be, if it's planned out correctly, I think 50 you may be doing a remote
We'll see.
podcast.
No
back
commitment
over.
yet. But
All
yeah,
right, no commitment. I won't say
50's
anymore.
50's coming. 50's
I won't
coming.
say it anymore. We'll get back to the days of where in the world is Mike? At the beginning, it reminds me of the first probably 10 podcasts we did when I was always looking at the different backdrops. So I'll be looking forward to see that again. Maybe that's all we'll say on that. So
that's right. And just before we head in, I just want to give a quick thanks to everyone who took a few minutes to go to, help vote for us in the Stroke Hero Awards. It's really happy, to have the amount of votes that I have right now. Super humbling. I'm sitting in third place, stiff competition with a hospital group out of Toledo and a neurologist out of Houston, who I'd love to have on the podcast, and say, let's, obviously they're doing important work as everyone who is nominated. So really be happy, kudos to them. I'm trailing quite a bit, so I don't know if that's gonna be a win for us. But again, like I said before, it's the nomination. Obviously my competitive nature, yes, it would have been nice to win. But it's, again, going back to what we said around these organizations being support, like it's advocacy efforts. We're not in it to make $1 million or, make a lifetime retirement in, St. Barth's, but like we're in it to support others and to have this type of recognition, from a nomination of an organization like ASA, truly does mean a lot. And yeah, just thank you again to everyone who went out and voted. Again, competition does close up around, I think, another 4 days or so. So by the time this is out, it'll probably be wrapped up. But thank you again for your efforts.
Yeah, thank you all. And without further delay, let's bring in Sarah Belson.
Hi, Sarah. Welcome to the No Stroke podcast.
Hi, Mike. Good to be here. Thanks for the invite.
Absolutely. So we've been personally connected now for, I think when I reached out to you, just a couple of months back, I thought the first time we connected was right before the pandemic. I was still in Dublin. Your involvement with the the World Stroke Organization really got my attention for, that work you're doing to bring the right people to the table, really, and have that international perspective, on both from a leadership, but from an advocacy point of view as well. So I'm really happy to have you here and dive into some of your work. So for our listeners, why don't you kind of give a bit of a background on Sarah Belson, what's been your career to date, and brought you to your role today with the World Stroke Organization?
Yeah, sure. So a little bit of background. I'm based in the United Kingdom, and I work with the Stroke Association here in the UK, which is a national stroke organisation. And I also work with the World Stroke Organization. So that's the only global organization that's solely focused on stroke. And the primary purpose of my role is to engage with and support the development of stroke support organizations around the world. And these are non-profits or charities that may be focused on stroke awareness raising or service delivery, advocacy, and some of the larger organizations fund research. And they are key collaborators in driving improvements in stroke care, along with medical professionals and policymakers, and ensuring people with lived experience participate and collaborate and even co-produce interventions and policy. And how did I get to this role? So I've had a career of about 25 years in international development, and that has always been focused at the community level with individuals and organizations. And I guess really as I reflect, I think one of the most important things for me is that I've witnessed the incredible and impactful activities that community members deliver, often with very limited resources. And I think over the period of my career, I've really appreciated the importance of taking time to really listen and try to understand people in the community, that we're dealing with a particular issue or a challenge, not to make assumptions as an outsider and to jump in with solutions that I thought would work. And those moments of really slowing down and sitting alongside and listening have really helped me to build relationships and work on ways forward together with the people that are most closely impacted by a condition or a challenge. And so this way of working I've kind of brought into my work in the stroke world. And I recognize that community stroke support programs are often the interventions with the closest proximity to people affected by stroke. They may offer the most practical, meaningful and ongoing support, as they are in and of the community. When I say that, I mean both the geographic community and the lived experience community. And I think a lot of what drives my work is the principle of nothing for us without us. So, you know, according to World Health Organization, working with communities and individuals who have first-hand experience and in many cases expertise regarding their health and healthcare and the context is essential when we think about designing effective and equitable interventions. And it's this approach and these principles that I'm really trying to bring into the work that the World Stroke Organization does, not single-handedly. I work with many people that are invested in this area of work, both some of the largest stroke support organizations around the world, but also representatives of smaller organizations in lower resource settings. And I think by us working together as this global community, we can really help to drive improvements in stroke awareness and treatment and care.
Yeah, thank you for that introduction, and thank you for joining the show. I know we're on different time schedules here, so I appreciate you making time for us. You said something that was a quote from the WSO: "Nothing for us," or "Nothing for us without us." That really that resonated, because here in the U.S. In some of our efforts that Mike and I do, I was in a group forum, and they were mentioning, it was stroke survivors, and they were saying, don't tell us what we need, ask us. And it was very similar. And I would love to, if we can just talk. I know in the second half we're going to get into the event that went on there recently, but can you because it seems like it's a real heavy lift. How do you unite individual communities? And Mike and I refer over here, there's a lot of small siloed groups that are really these, I think you've heard them as stroke support organizations, but how do you that's a big task. How do you get them together? Is it by way of the event that you had, or what? We can talk about the barriers and the funding formula, but I'd love to know more how you unite those voices.
Hi, David. Thanks for that question. And I would agree with you wholeheartedly. It is a heavy lift. It is challenging. It can be very time consuming. It takes sensitivity and respect. And I think I'd go back to my previous point around really just taking time to listen and understand. And that requires investment, World Stroke Organization and the Stroke Association in the UK invested in my role. They said, this isn't just a nice to have to connect with stroke support organizations or community groups, people with lived experience around the world. It's fundamental. And in order to do that, we've got to resource it. So my role is all about that. It's about, if we get an inquiry in the UK from somewhere in sub-Saharan Africa or Asia, maybe previously we'd have given quite a generic response because we didn't have access to information about what was happening in a particular context. Now those kind of inquiries come to me, and more often than not, I will know an individual or organization in a particular country that I can connect people to. Or if I don't know, I'll do the research to try and find an organization or individual. So I think it takes resourcing in order to uncover knowledge and insight and connections, all of which help facilitate connections internationally. So I don't think it's rocket science, really. It's about resourcing, recognizing it can take time. It's fundamentally about building up relationships, and we all know that any relationship requires investment of time and money and other things. So I guess that would be my answer to that. I don't know if that is fully answers your question.
Yeah, and I think to that point, right? Like you started by speaking to a lot of, obviously you're focused within the UK, but a lot of your work comes internationally based on the involvement with WSO, and I know you've spent a majority of your time, it sounds like it's an increasing amount within these developing countries, right? So we were speaking about you running into Ronan Collins before we started recording here, and his it sounds like he's going to be starting to do some work in sub-Saharan Africa as well. So like what are some of those, granted we speak about geographic locality, and of course there's regional issues that go on, but having this worldly view of these community groups, is there anything like particular that stands out, obviously like funding, things like that, but like universal challenges that you see these support groups having? And like is there a model that you're thinking about to kind of unite all these groups together, right? Whether it's a framework that could come into place and really help organizations scale regardless of location. Is that something you're thinking through?
Yeah, so I'll just give a bit of background about the stroke support organisation network globally. So in 2019, 2020, we did a mapping at World Stroke Organisation of all the stroke support organisations that were known to us globally that had been established in or before 2018. And so we included 92 stroke support organisations from 58 countries. And as I said, those were the ones that were known to us. We know that there are many more. And yes, we found, many challenges, or they expressed many challenges about, the sustainability of human and financial resources. The majority of these organisations don't receive any government funding. And while the numbers of volunteers can be a strength, there is a real lack of paid staff in many stroke support organisations, which limit their potential for large scale impact. But also these organisations are challenged by the context in which they're operating. So there may be inadequate national stroke strategies and policies. So there's nothing for them to necessarily leverage. They haven't got the attention of governments, both in terms of policy development and resource allocation. And there's also a lack of data on stroke incidence and prevalence in many parts of the world, low awareness of stroke symptoms and emergency response, and inadequate recognition of rehabilitation. So all of these issues that a stroke support organisation is trying to grapple with, both at the individual level, the community level, the national level, all impact on their ability to drive improvements in stroke awareness and treatment and care. But on the flip side of that, and that's not diminishing any of those challenges, there is huge potential for these organisations. Many organisations are mobilising large numbers of people affected by and engaged with stroke. And as I've said, there are significant numbers of volunteers and members supporting their work and benefiting from their activities. So, a case in point would be the annual World Stroke Day events, really, driven by stroke support organisations, particularly in low resource settings. So the World Stroke Organization has many tools and resources that are free to the public and to our members. And so these organizations across sub-Saharan Africa and South and Southeast Asia are using these resources, getting out on the streets, getting the attention of policy and decision makers. So it's like, how do we harness that? Because that going back to the resourcing, we need to value their contribution. We need to see them as equal partners in stroke advocacy and campaigning, and really invest in their potential. But also another thing that we found that was really interesting is, even with the organizations that were very small and only recently set up in sub-Saharan Africa particularly, they are engaging across their local and geographic boundaries. They're engaging with international organizations, they're learning from them, they're using their resources, they're getting themselves around the table, in lived experience assemblies and activities. And so again, it's just like, people are, even with limited resources in very challenging contexts, are really trying to get involved and are successful at getting involved in the global stroke debates and initiatives. So I would definitely say there's challenges that we need to address, but there are also successes and potential that we need to harness.
Yeah, you brought up a lot of good points there, and it's in some ways it's very similar to what we see here in the States. We get very much a lot of energized volunteer groups, and Mike and I have, over the years here, have really dove into to kind of interview and see what their secret sauce is, and but it's the sustainability, right? It's like, and we see some of them work great for a couple of years, and then they go dormant because it's hard to maintain that level of effort without having someone else that can kind of help build those bridges that need to be built. But on the same token, the fact that you mentioned, there's enormous potential because they can be quickly mobilized and reactive. And we saw in our last interview with the stroke survivor, Tim Whitmere, who is doing something on the fitness side of things, but as a stroke survivor, Mike and I were talking about the potential of the coaching model and bringing that energy to be able to have a group form, sort of on a minute's notice, and take where a need is there. And and he mentioned, just to summarize, like, if he applied, he happened to have a really great stroke experience at discharge, but he saw others that he talked to in his group too, that went home with a pamphlet, and that was it, depending on their zip code. So I'm sorry, Mike, I didn't mean to jump in, but I was thinking of that as Sarah was mentioning, sort of the potential for that model and the obstacles too that remain.
Yeah, and you spoke about kind of the research and the funding, but the research as well, right? Where we as stroke survivors and those with lived experience, and obviously with your understanding as well, like, you've spoken to enough where, yes, we know, like, what are those issues that need to be addressed from a lived experience point of view, right? But when you mentioned the research, like, is that what doesn't align, right? Like, we need more research to say X is actually, like, it's foundationally needed to advance access to long-term care or whatever it might be. Not to jump ahead too much, but in the life, so the SAFE organization and the report that was just released, again, we could dive more on that, but I guess my question is around that research element. Is there a lack of current evidence that is backing what these stroke organizations are trying to pursue, which is why there's not that funding element aligned to what some of the things that we're trying to do are? Is that kind of a commonality that you're saying?
Yeah, well, I guess I would say it's not the lack of research isn't specifically about stroke support organisations. I think it's more generally about life after stroke issues as distinct from rehabilitation. Of course, there is overlap between rehabilitation and life after stroke, but there is a difference. And somebody like Avril Drummond would articulate this much better than me, but I think what is interesting in a report that the Stroke Alliance for Europe, which is a regional stroke support organisation, they commissioned a scoping review from King's College London that was released last week. And what they found in that scoping review was that there's too little research into the long-term needs of stroke survivors and carers. But this is also exacerbated by the lack of common ways of understanding, measuring, and meeting needs. And there's also a lack of information and preparation and support for stroke survivors and carers. The provision of community-based rehabilitation and support falls far short of people's needs. And some of their recommendations are that governments and research bodies and funders should provide more funding to investigate medium and long-term needs of stroke survivors and improvements in service provision to meet those needs. So it is an investment in life after stroke research, but that also, of course, as we know, sits within a wider health and social care system. And the system needs to be designed to provide high quality information and support that is easily accessible. So I think that the places or the areas where things need to improve, yes, is research, but it goes alongside a systemic change in how life after stroke is addressed, and the needs of stroke survivors are met.
That makes a lot of sense. And we'll just to kind of wrap up before we fully dive into Stroke Alliance and some of Avril Drummond's work. I want to discuss. I just want to kind of recap on the kind of benefits of being involved in the World Stroke Organization. Right, I was I had the pleasure to be at the International Stroke Conference out in Dallas, and some of your colleagues were there with a promotional booth. And it might be the American's perspective, right? But I wish there was more of that presence of World Stroke, right, and coming together, just as you're saying, right, of that alliance, at a global perspective to really kind of be considering these issues. And I know, some of our past guests actually from Australia, Stephen Dunnan and Jeffrey Davis, they've been past presidents of the World Stroke Organization. But I'd love for you to, again, before we kind of move on to the recent event through Stroke Alliance, just recap the overall benefits of becoming a member, right? Because you could be a professional, you could be folks with lived experience, there's different ways to get involved, and maybe highlight something that I've really taken advantage of and have enjoyed is the Stroke Connector. So if you want to kind of summarize that up for us, that'd be great. Yes,
sure. So as you say, the World Stroke Organization has members that are individuals and also societies. And the societies and individuals, in fact, come from all different backgrounds. So you might have medical professionals, and which include nurses and allied health professionals and neurologists. But also we have members that are stroke support organisations, and stroke support organisations again may include medical professionals, but they certainly include people with lived experience and lay people. And so we have this growing diverse membership of World Stroke Organisation. and the clue is in the name, right? We reach out across the world. So one of the key benefits I feel is that we can connect people, so we can begin to break down some of these silos geographically and also across the stroke care pathway. We also have the World Stroke Congress, and as a member you would get reduced rates, and the content of the World Stroke Congress is increasingly addressing issues across the pathway. It is not solely focused on pre-hospital or acute treatment. There are a number of sessions that will include rehabilitation and recovery, and increasingly we're facilitating the involvement of people with lived experience at the World Stroke Congress. You mentioned Stroke Connector, which is our online platform for not only our members, but for anyone engaged in long-term stroke support and advocacy. And this is where people can share their tools and resources that they've developed, their patient education materials, their reports on their World Stroke Day. So it's really a space for people to showcase their work, but also a space for us to signpost people to the resources of our members. And then the World Stroke Academy is the educational platform of the World Stroke Organisation. And this is really focused on high quality educational material for healthcare professionals worldwide. So we would really make a distinction between the two platforms. World Stroke Academy very much for healthcare professionals, and Stroke Connector very much for advocates, people with lived experience, and those involved in long-term stroke support. I think I'll stop there.
Many pieces to the pie, but we'd love to get to kind of dive into that with a colleague around the World Stroke Academy. I think that's super important work that's happening as well. And a little plug again, you mentioned the World Stroke Congress. That's going to be coming up in October, I believe, right?
Yes, in October.
In
Toronto. Yeah.
Yep. So maybe not as nice as sunny Barcelona, but Toronto, I hear, is a nice city. So we'll see. So yeah, and you could head over to worldstrokecongress.org to learn more. I believe our abstract submission still open? Do we know?
Yes, poster abstracts still open, I think, till mid-April. Perfect.
So yeah, encourage everyone to go over, learn more about World Stroke Organization, learn more about the World Stroke Congress coming up. But let's take a quick break, and we will be back to chat about your time in sunny Barcelona and the Stroke Alliance for Europe. All right, and we're back here with Sarah Belson. First half of this, we covered a lot around your involvement from a community support angle, with both Stroke Association UK and the World Stroke Organization's involvement. But we'd like, and we hinted at this a couple times in the first half, but you were recently at an event in Barcelona put together by the Stroke Alliance for Europe. And the topic was really focused again within life after stroke. Super important. And we're this kind of the involvement of a few different organizations, but a woman, Avril Drummond, whose name we mentioned as well at the start. But I'd love for you to just kind of give a recap of how that organization, or so alliance, should I say, is structured, and really the importance of that and what's happening within Europe.
Yes, sure. So I think what's interesting is that our connections between organizations really demonstrate that there is a global stroke community. So for a bit of context, the Stroke Association UK is a member of the Stroke Alliance for Europe, And the Stroke Alliance for Europe is a member of the World Stroke Organisation. So we're one interconnected and functional family. So the Stroke Alliance for Europe is the voice of stroke patients and survivors in Europe. It represents a range of stroke support organisations from more than 30 European countries. So I guess the important to highlight the difference here. World Stroke Organisation membership is drawn from medical professionals, medical societies, and stroke support organisations, whereas the Stroke Alliance for Europe is solely focused on stroke support organisations. And its goal is to increase the number of and the impact, decrease the number of and the impact of strokes in Europe by advocating for better prevention, equal access to treatment, post-stroke care, rehabilitation and support. And so a really important initiative of the Stroke Alliance for Europe is the European Life After Stroke Forum that was set up in 2019. And during the pandemic, hosted a number of webinars, but then hosted its first face-to-face meeting, the Life After Stroke Forum, just last week on the 10th of March. And the forum was really an opportunity to raise the profile and interest in life after stroke care and support, and to call for it to have equal status with other stages of the pathway. So acute care and rehabilitation. So all parts of the pathway have equal investment and are given equal priority. And Stroke Alliance for Europe want to do this to address the experience of many stroke survivors that feel abandoned when they are discharged from hospital and as they navigate life post-stroke, which we know is not short term. So that's really was the purpose of the forum. And I have to say, it was a one-day forum. Many of us as delegates there wanted it to continue. There was a really great energy. It was wonderful to dedicate a whole day to talking about life after stroke issues from across Europe. And it also included the launch of the scoping review, A Life Saved is a Life Worth Living. So I would encourage people to go to the Stroke Alliance for Europe website and have a look at the summary report. The event included people with lived experience in setting the agenda and in speaking at the event. So the stroke survivors from Portugal, Scotland, Spain, Denmark, really, really important that we were all equal delegates and participants at the conference. And the issues that were talked about were identified by stroke survivors as topics that they wanted to dedicate some time to talking about, and bringing in people with lived experience to those sessions, and also academics and clinicians. So we had sessions on getting back to driving after stroke, intimacy, relationships and sexual well-being after stroke, and physical activity. And a session I went to and I left feeling so inspired, and I'm still thinking about it, and it will inform some of my work going forwards, was a session called Creating Services and a Community Where People Live Life Well After Stroke. And in that session, we heard from stroke survivor Jim Curry from Scotland about him feeling abandoned after his stroke, and issues that he faced he wasn't really prepared for. And so one of the things that Jim did is he was looking for a stroke support group in his area, and he couldn't find one. So he created his own stroke support group for younger stroke survivors. And then as the participants in the session, we discussed what we felt were the priorities for creating services and a community where people live well after having their stroke. And the top 3 priorities we identified as a group were timely information and support, respect and investment in stroke support organisations. And I have to say, it wasn't only me that was advocating for that. There were many representatives of stroke support organisations in the room. And also we talked about, or we prioritised the meaningful involvement of people with lived experience as the people that can really help to identify what the needs are and support the development of services and interventions that are most important to stroke survivors. And then finally, I was just really impressed by how clear and accessible the talks on secondary prevention were. You mentioned Ronan Collins. He talked about medical secondary prevention, but we also had talks on nutrition and wearable technologies, and just really gave people insights and full and accurate information. So, just congratulations to all of those that organised it.
Sounds like a great event and timely topics. And you were there in person, and sounds like survivors and caregivers had a voice in planning the agenda as well. Was there access for folks that I know it was live and in person, but was there a virtual component to bring in more in any of these breakout sessions, or was it all live this year?
It was all live. So it wasn't, we couldn't bring people in virtually, but all of the presentations will be available on SAFE's website, Stroke Alliance for Europe website. So there are certainly efforts to ensure that the learning and some of this discussion is shared beyond the people that were there in person.
Nice. And, I think that's something that we in America, need to do ourselves, right? Like this is, and David's, had his experiences kind of going into the International Stroke Conference for years, but like that's meant to be focused on like acute stage and late breaking science and kind of those aspects of stroke care, and that's okay, right? That's important pieces of discussion that needs to happen, and getting the neurologists to the table and these stroke care teams that are focused on that acute phase and getting them through. But in the same sense, like what Stroke Alliance for Europe has created and the ability to kind of give patients and those with lived experience and folks like yourself who've actively invested your career into community support organizations and that value driver that we know is there, really giving them that voice. But I'd be curious, and maybe we're looking to get Avril on, so I'd let her dive into this at a deeper level. But I mean, what do you, in your position, right, and from a community support point of view, like what's the ideal long-term outcome of this alliance?
Of the forum or the Stroke
Alliance, the Stroke Alliance for Europe, right? Like what's the outcome from a community support organization, right? Is it impacting these policy changes, advancing research? Like what would be the most important thing for you to see as an outcome of? And of course it's going to be a never-ending thing, right? Like it's not like this is the end of the game, like you could see the road there, because there's always going to be work to be done. But I mean, what's some of the most important aspects of this alliance, and again kind of tying up to the World Stroke Organization, for you to see happen with it from a community support lens?
Well, I think that the most important thing for me, I'm not a member of the Stroke Alliance for Europe, but I appreciate and value how important such an alliance is, because it brings together stroke support organisations which primarily involve people with lived experience and carers, but also medical professionals. And I think it's the power of that alliance to actually begin to influence things at an EU level, but also then share experience and insights from different countries, what works, what doesn't work, how can we learn from each other about interventions in the life after stroke space. So I think what we're saying is that an alliance like SAFE is helping to break down the silos between nations. It's making or facilitating a collective voice, which is much more powerful at EU level. And I think it is also a demonstration of great practice and collaboration at a regional level that other regions can look to and explore. So I know that colleagues from Sub-Saharan Africa and from Southeast Asia have said, we know there's a SSO alliance in Europe. Could we be doing something similar in our regions to actually begin to influence policy and practice? So yeah, I think without meaning to be cliched, for me, it's about the strength of collaboration and the power of numbers and working together.
That's a really good point, because you don't have to recreate the wheel each time. There's a lot of great efforts happening in different areas, and I and I'm glad Mike brought it up this time, because this has been something over here in the States that I've been really trying to get more advocacy or more presence at our the international conference here doesn't have a lot of representation or potential for, or avenues for even getting in the door, but then having the educational opportunities that need to be a bigger part of that conference, in my opinion. But you're in a very unique position in your work in Europe, and we're getting to that point of the show where we ask our magic wand question. And with all the work that you're really in there, you're rubbing elbows, you're connecting these communities, you're mapping what needs to be done. So really interested in your answer to this. But we end each episode with the magic wand question, which was, if we were to give you a magic wand, one much more powerful than this here, how would you redesign the stroke care pathway?
Wow, I love this question, the magic wand question, but it's a big question, right? So
sure is.
So from my perspective, I would focus on the life after stroke stage of the pathway, not to the detriment of other stages, but to ensure that the issues that are most important to stroke survivors, families and carers when they're navigating a life after stroke are given equal status with other stages of the pathway. We know that research and workforce and financing are challenges, but we need investment to ensure that people affected by stroke can live the best life that they can after experiencing a stroke, with the right treatment, support, no financial burden, opportunities to participate and to return to work and meaningful activity. And I'll just add to this, because that's very much my thoughts at this moment. But two different individuals, I won't name them because I haven't asked them their permission, but we were talking about global challenges in stroke research and what would that focus on. And inevitably people talk about stroke funders wanting or being excited by acute treatments, the next development in acute treatment that is able to attract large levels of funding, and it's seen as transformational. And somebody said, why can't rehabilitation and recovery be transformational? We need to address that and create that narrative that actually investing in life after stroke issues and research can be transformational. And it's important that we get that message across to funders. And then somebody else, just at the European Life After Stroke Forum, began her session talking about a tweet that she had sent a couple of years ago and said, wouldn't it be amazing, you know, I'm not getting the exact, I'm not saying this verbatim, but wouldn't it be amazing to see the day when stroke survivors don't talk about feeling abandoned, that they left hospital and their life after stroke journey has been brilliant and they've got all of the support? Wouldn't it be amazing when we get to a point that is the reality? And I suppose those two things have really then, or those two comments have really impacted upon me. Rehabilitation and recovery is transformational, and it needs that level of investment to achieve that transformation. And we should be striving for a day when people are discharged from hospital and they do not feel abandoned and alone.
Yeah, and those words, that's a great answer, and those words are universal here too. You know, I was, as you were describing that, I was thinking back to, you know, we had Pam Duncan on, and she did a lot of work, and you know, the one patient perspective she shared on our show a few episodes back was, you know, I was from a stroke survivor, I was life flighted in and got the best care, and then I was returned home and dropped out without a parachute, and that drop off and that disconnect after, and that's kind of, you know, the battle we're all fighting to improve that access and that part of the pathway. So
yeah, and you know, so like, you know, I think everything that you highlighted today, and you know, the work that you're doing both at, you know, a local UK level with the World Stroke Organization and in these developing countries, like it's, you know, people like you and the experiences and the value that you're creating within these small groups of leaders to then again come together as one voice, break silos, like, you know, to the point of that stroke survivor who got on stage and said, you know, I hope one day, you know, you won't be left falling off a cliff when you leave the hospital. Like, it takes your work is so important to get us to that stage, right? You know, everyone that you've been involved in, though, these stroke support groups across the world, they all have valuable insight, and it's coming together as one, like you said, you know, to really drive that voice for change, and I'm confident we'll get there, right? It's going to be a long road, and there's a lot of, you know, things that need to change, you know, at a regional level, but you know, like you said, there's these systemic global level issues that I think can be addressed with, you know, the right involvement, and you know, the individuals like yourself and, you know, everyone involved within the World Stroke Organization, European, you know, Stroke Alliance, and you know, here in the States, you know, we hope we could be, you know, that group that again comes together from an alliance point of view and brings these siloed groups together to drive the same change that you're looking at, you know, in these different parts of the world. So look, it's been fascinating conversation. Really, really thank you for coming on and, you know, giving us this insight of, you know, the World Stroke Organization, everything that you're doing, you know, at a local and global level. And we hope to maybe see you in Toronto in person and be able to have a chat there.
Oh, thank you, Mike. Thank you, David. Really great to talk to you both. And indeed, let's definitely meet up at the World Stroke Congress in October in Toronto. That would be an absolute pleasure.
Let's plan for it. That'd be great.
And for folks who are interested, get in touch. You know, are you comfortable sharing like social or you know, the best way we could?
Absolutely. I'm always keen to engage with people wherever they are in the world. So my email, Sarah Belson @stroke.org.uk, and you can find me on Twitter @Belson Sarah.
Lovely. Yeah, we'll post that in the show notes. But thank you, Sarah. It's been a pleasure, and we'll catch up again soon.
Thank you.
Brilliant. Thank you both. Have a good day.